Your new Hoyer lifter is designed and built for years of trouble-free service. It provides a safe and convenient way to transfer your patients. This program is designed to make life easier and safer for you and those in your care. Our goal is to acquaint you with proper lifting procedures. The program is divided into two segments. In the first segment, we'll discuss 1. Why lifters are important, 2. The basic parts of a lifter, and 3. How to evaluate and plan a lift. In the second segment, you'll learn how to safely use a lifter, the various lift and transfer techniques, and finally, additional components and attachments for your lifter. When you're finished, you'll understand how to prevent accidents and injuries to you and your client. You'll be able to demonstrate the proper use of a lifter. You'll be able to transfer a client to or from a bed, install or remove a sling, transfer to and from a wheelchair, lift someone from the floor, and access the bathroom or bedside commode. Following the program, you'll be tested to make sure you understand each step of the procedure. You'll also be given the opportunity to practice lifting each other. As a caregiver, it is equally important that you understand how a resident feels during a lift. Hoyer lifters help you lift and transfer people with a minimum of physical effort on your part. We recommend using Hoyer lifters whenever someone is too heavy or is unable to assist in their own care. Your Hoyer lifter can help prevent injury to you and your client. Before we begin with lift and transfer techniques, let's take a quick tour of the lifter. Hoyer makes several models including hydraulic, crank-operated, and power-driven lifters. While each of these lifters has features that make it unique, they share some basic similarities. By learning the components and construction of one model, you'll understand the basics of several different lifters. Let's begin at the bottom with the base. The base includes the frame and casters. There are two types of bases, fixed and adjustable. C-base lifts have fixed position legs. U-base models can have fixed position or adjustable legs. The adjusting lever handle controls the spread width of adjustable legs. Casters allow for easy movement during transfers and lock the unit in place when it is not being used. The upright section of the lifter is the mast, which provides vertical support for the lifter. Attached to the mast is a handle for moving and steering the lifter. The boom, which provides the lifting motion, is also attached to the mast. The cradle attaches at the end of the boom. A variety of slings, each for different lifting situations, attach to the cradle. Slings support your passenger during a lift. Hoyer makes both powered and manual lifters. Manual lifters may be operated by hand crank or by a hydraulic pump. Long, smooth strokes activate the hydraulic pump. Turning the knob to the right clockwise enables the pumping action to raise your patient. Turning the knob to the left counterclockwise opens the valve and lowers your patient. It is extremely important to practice this lowering technique to assure a safe and smooth transfer for the patient. Powered lifters rely on a sturdy, battery-powered electric motor and are operated with a handheld controller mounted between the mast and the boom. You can be sure Hoyer power lifters are safe and dependable due to several key safety features. To immediately stop all movement of the actuator, just push the red emergency stop button on the battery pack. All movement of the actuator will stop. To resume operation, simply turn the red button to the right. In the event the handheld controller malfunctions or is disconnected from the lifter, you can use the override switch to safely lower your patient. Another important safety feature on Hoyer power lifters is the mechanical emergency release pin. If the lifter should ever fail due to loss of power, you can still lower it by pulling the orange pin. It's preset at the factory to lower the resident slowly and safely to chair or bed. Lastly, to prevent patient entrapment or accidental pinching, the boom and cradle will stop automatically if it encounters any resistance while it is lowering. Your Hoyer lifter runs on a sturdy, battery-powered electric motor system. When the lift is not in use, the battery charger should be plugged in to ensure a full charge whenever it's needed. Your lifter will run all day on a full charge. The included battery charger cord is enclosed in the power actuator. Just plug one end of the cord into the charging unit and the other end into any regular wall outlet whenever the lift is not in use. The amber charge light will come on during the charging cycle, and it will go out when the battery is fully charged. Full battery capacity usually takes about 6 hours. Because this is a gel cell battery, you can't overcharge it. Just plug it in any time and leave it plugged in without risk of battery memory. Now that you're familiar with the key components, let's move on to the basics of lifting. There are some basic do's and don'ts that apply to every lift situation, and anyone using a lifter must be familiar with these procedures. Failure to follow them could result in serious injury to you or your passenger. Lifting is typically accomplished by a team of 2 caregivers. Always refer to your facility's standard operating procedures for resident transfer using mechanical lifting devices. It is important that both caregivers performing the lift understand the proper techniques and communicate well during the procedure. One member of the team should be team leader and direct the other. You need to be comfortable in either role. Always begin by planning your lift before proceeding. You'll want to evaluate both your environment and your passengers' needs. Go over the lift in your mind from start to finish before you begin. Make sure you have a clear path from where you are to where you want to go. Take time to clear the path if necessary. Lifters are intended to take the strain and discomfort out of transfers. For longer transports, a wheelchair is a better choice. Lifters were not designed to travel over deep carpeting or uneven surfaces, nor were they intended for outdoor use. Use a lifter for traveling short distances only. Never use your lifter to lift anything other than a person. After reviewing your environment, you'll need to evaluate your passengers' needs. Be sure that the weight of your resident does not exceed the capacity of the lifter. Hoyer lifters safely lift from 300 pounds to 600 pounds. This should easily manage the majority of lift situations you face. Slings are available in several sizes and styles, each designed for a variety of applications. Hoyer's medium-size 4-point padded U-Sling will fit the majority of your residents. An agitated or confused resident may require a full support sling like the 4-point padded U-Sling with headrest. An amputee or resident with moderate to high body rigidity would be more comfortable with the one-piece full-body sling. Choose a sling according to the patient's size and weight, degree of disability, and the type of lift or transfer you're performing. Adjust the sling to suit your passenger. Slippery garments could cause him to slip out. He should be in a sitting position, facing the caregiver, with his knees slightly higher than his waist. His feet should ride on the base of the lifter, straddling the mast. Always explain each step of the lift to the resident before you begin. Someone who knows and understands what is happening or is about to happen is less apprehensive and more cooperative. Team members must remember to communicate also. The resident should be facing the caregiver with his weight centered over the base of the lifter. When transferring to a wheelchair, bring the chair as close as you reasonably can. That reduces the time your resident is up in the air. He'll appreciate that. Another important safety rule is never lift someone higher than necessary. A lower center of gravity reduces risks and makes a more stable and secure lift. After assessing your environment and your patient's needs, decide which transfer technique is appropriate. Follow these simple guidelines and lifting will be safer and easier for you and the people in your care. Now let's demonstrate a typical transfer from bed to a wheelchair. You've planned your move. There are no obstructions in your path. You have the right lift and sling for the job, and you're ready to proceed. We'll be using the Hoyer Power Lifter. Working together, caregivers prepare for the lift. During the lift, one will operate the equipment while the other observes the lift, helps position and reassure the resident, and offers assistance if needed. Before you install the sling, it is very important to inspect it carefully for frayed or worn spots. Check the seams to be certain they are intact. Inspect slings regularly and follow the simple cleaning instructions to get maximum service from your slings. To install the sling during a lift from a bed or prone position, we'll use the log roll technique. With his knee bent, roll your resident to one side. Whenever possible, ask the resident to steady himself by holding onto the side rail. Fold the sling as shown. Slip it under the resident as far as can be done comfortably. Roll the resident onto one side. Place the folded sling halfway underneath so that the lower edge is just slightly below the knees. Now roll the resident back towards you and pull the sling through, similar to positioning a draw sheet. It will help to raise the head of the bed after the sling is positioned to aid in connecting the sling. Now, bring the lifter into position. Lower the swivel bar over your patient so the chains can easily be attached to the sling. The red indicator mark on the chain link is a start point for attaching the chain to the swivel bar. To help position your patient, the shorter linkage should be attached to the top shoulder portion of the sling, while the longer linkage should be attached to the lower leg portion of the sling. If you're using a lifter with adjustable legs, always spread the legs wide open before a lift. Roll the base as far under the bed as possible, centering the cradle over your resident. Take care not to bump his head with the cradle while positioning it. Never lock the wheels during a lift either. The wheels must be free to center the cradle over your passenger. Now, lower the cradle just enough to connect the sling. Double check to be certain the cradle is centered over his navel. Make sure to attach the S-hook through the hole in the metal bar so that the end of the hook is facing away from the patient. Raise him only slightly and make certain that he's comfortable and correctly positioned. Raise him slowly until he's just clear of the bed. A self-leveling cradle will bring him into a sitting position. As one caregiver uses the controller to gently raise the passenger from the bed, the other checks to see that all loops are properly secured. Lower the near side rail. Rotate his legs so they overhang the edge of the bed and he's facing you and the lifter. Lower the bed if you need more clearance. Make sure there are no obstructions over the bed or in your path to the wheelchair. Grasp the steering handles and move the lifter away from the bed. Never push or pull on the boom or the sling. Always steer the unit with the handles on the mast. They're designed to make maneuvering the lift safe and easy for you regardless of your size. Place his feet on the base while you move him to his chair. When transferring to a wheelchair, always make sure the wheelchair wheels are secured. You need to know you can count on a secure place to seat your passenger. Position the sling over the chair. Slowly lower the sling and guide him into the chair. Just before he makes contact with the chair, gently lift on the back of the sling or press down gently on his knees with your free hand. This will help him get seated in a comfortable upright position. Now, lower the cradle until there's no weight on the chains. Unhook the chains from the sling, then slightly raise the boom to assure safe headroom, and remove the lifter. Removing the sling is optional, depending on your passenger's needs. If another move is imminent in the near future, you may decide to leave the sling in place. If your resident asks you to remove it, however, be careful. Pulling on the sling could cause him to fall forward. One attendant should be positioned in front of your seated resident. The other caregiver gently pulls the sling flaps from under the resident's thighs and off to the side. Lift his legs slightly if necessary. With the other caregiver standing in front of him, help him lean forward. Place his arms on his knees for stability. You can also lean his head on your shoulder or chest if you prefer. Now, reach back and pull the sling from behind him. Be sure to help him reposition himself in the chair. While you never lock the casters on your lifter, you always lock the wheels on a wheelchair to ensure stability during a transfer. When installing the Hoyer 4-point sling, fold the sling as shown. Lay the sling down with the label facing up. Turn each leg section inward and flip it up. Position yourself in front of the chair. Gently lean her forward and put her arms on her knees for stability. Place the folded sling behind her and tug it down so the bottom edge touches the seat of the chair and the top edge is aligned just below her shoulder blades. The folded leg flaps should be on the outside. Cross the loops through the big opening. Attach the leg strap loops to the front cradle hooks. Use the bottom loop for standard positioning, the middle and upper loops for increased leg flexion. Attach the shoulder straps to the two back cradle hooks. Use the shorter loop for an upright position and the longer loops for a reclining position. Raise the cradle slightly to make sure she has enough headroom. Using the steering handles, carefully position the lifter in front of the chair with your resident straddling the mast. Remember, never push or pull on the boom or the sling. Always steer the unit with the handles on the mast. Make sure the footrests are in the upright position and raise the lifter until she is just clear of the chair. While the operator gently raises the unit, the observer double-checks connections and makes sure the passenger is secure. Remember, never raise your resident any higher than necessary to complete your maneuver. It's uncomfortable and it can be dangerous. Once out of the chair, place her feet on the base for travel. Now let's transfer someone to the bed. First, lower the bed all the way. Raise your resident until her buttocks clear the top of the bed. Using the steering handles, move the base of the lifter all the way under the bed. Get her centered over the bed. Now, lift her legs and rotate them over the bed. Carefully lower her onto the bed. Lower the cradle until there's no weight on the loops. Unhook the loops from the cradle. Raise the cradle slightly and move the lifter out of your way. Use the log roll method to remove the sling. It's as easy as that. Lifters are designed for transferring people. Transporting people over longer distances should be done with the proper equipment, such as a wheelchair. However, if it ever becomes necessary to transport someone for a short distance, make sure the resident is facing the caregiver. Keep the lifter as low to the ground as possible. A low center of gravity reduces risks and results in a smoother, more secure ride. Never transport residents over shag or deep pile carpeting, thresholds, unpaved or uneven surfaces, or outdoors. Forcing a lifter over an obstruction can cause it to tip or cause damage to the lifter. We recommend Hoyer lifters for transferring residents using proper methods and techniques. The strength of Hoyer lifters is their ability to lift safely and comfortably with little physical effort or risk to you or the person you're caring for. Transporting a resident calls for equipment better suited to that task. A Hoyer lifter may be your best friend when it's necessary to lift a resident from the floor. Here more than ever, take time to review the situation before you begin your lift. Always work as a team, and never attempt to lift someone who has fallen and may be injured unless he's been examined by a medical professional. To lift someone from the floor, install the sling using the log roll method described earlier. Using the steering handles, approach the resident from either the foot or the head, depending on the situation. Place a pillow under him to support his head and neck. Center the boom over his midsection as closely as possible. Now lower the cradle until the sling loops reach the cradle hooks. Raise his knees and attach the sling to the cradle. Lift him gently and turn him to face the caregiver. As one caregiver uses the controller to gently raise him, the other checks to see that all loops are properly secured. Whenever possible, place his feet on the base and keep the cradle low for a smooth, secure ride. Hoyer lifters are designed to provide easy access to most bathroom facilities or bedside commodes. Using the steering handles, just position the lifter around the commode. Carefully lower the resident onto the commode until there's no weight on the support loops. Unhook the loops from the cradle and pull them out of the way. If possible, leave the sling in place. When finished, reattach the sling. Lift slightly and make certain that all connections are secure. Raise the cradle until his buttocks are clear of the commode. Using the steering handles, move the lifter away. Be sure to lower the resident and place his feet on the base for transport. Your Hoyer lifter may have an optional scale mounted between the end of the boom and suspension cradle. All it takes to operate is a single button. Drape the sling over the cradle. Press the 0 button to zero the scale. This compensates for the weight of the sling and assures an accurate reading. Now, apply the sling and lift as usual. Of course, you always use sound transfer techniques. Raise the resident until his feet are completely off the floor, but no higher, and read the scale. It's that simple. As you lift, the scale will give you a digital readout of your passenger's weight, accurate to plus or minus 1%. And there's no need to turn off the scale. The display will automatically turn off after 1 minute. If the display of your patient's weight goes off before you're able to record it, simply press the on button again. The original reading of your patient's weight will still be there. During our program, we've discussed the importance of knowing and using proper techniques to safely and effectively use your Hoyer lifter. Now you're familiar with the basic components of your lifter, and you've learned to evaluate both the lifting environment and your resident's needs. You've also learned to safely lift and transfer in a variety of situations. After watching this program, it's recommended that you practice lifting with the help of other caregivers. Each of you should be familiar with every aspect of the lift process, as the observer, the operator, and as the passenger. The better you understand the dynamics of lifting, the better you'll be able to perform your task in a manner that is safe and comfortable for both you and the people in your care. The more you practice, the more proficient you'll become. The confidence you gain will translate to a more confident, comfortable resident as well. Hoyer lifters, when used and maintained properly, provide years of trouble-free service. And they can make your job easier and safer by following the guidelines we've discussed here and in our instructional manuals. Now, to complete your training, please refer to your learning packet. Follow the instructions to complete the certification process. Thank you for your attention.